June is the month of men's health. I am a consultant urologist at the Norma Medical Specialty Center in Kuching, Sarawak. And today I'm going to talk about some issues regarding men's health. Men in Malaysia live to 76, whereas women live longer until 78. So maybe this month is the good time for us to have some prioritize over the issues regarding men's health. Men's health, as compared to women, have some special issues. Men have the prostate gland, which often is thought to be the source of urinary symptoms, although the bladder is equally important. The bladder can be overactive or underactive. In men also, we have the testicles, which is important for production of testosterone, as well as producing sperm for fertility. And of course, men have the penis, which is important for sex, for ejaculation, and for orgasm. And my next topic of serious discussion is on erectile dysfunction. Men have a few serious health comorbidities, in particular the metabolic syndrome, which is diabetes, hypertension, abdominal obesity, and dyslipidemia. Some communities in Malaysia, the incidence of diabetes can be up to 30 to 50%, and men above the age of 40 in Malaysia have an incidence of hypertension of up to 40%, and only 35% of these patients have good control of the blood pressure. Colonic cancer, of course, is common in men and women and is highly preventable. Heart disease is an important cause of mortality in men, and this heart disease can be coronary artery disease or heart failure. This is a famous diagram from the Lilly company, and the idea is about sexual function of men, and of course this leads to the next important topic of erectile dysfunction. Erectile dysfunction is defined as the persistent inability to achieve and or maintain an erection sufficient for satisfactory, mark the words, satisfactory sexual activity. It is better than the term of impotence, which implies futility, and in Malay is called mati pucuk. Dr. Ismail Dambi in 1998 did a study in Kuala Lumpur and found that 16% of men have complete erectile dysfunction. But what is more important is that erectile dysfunction actually should be considered as part of the total wellness of the patient. So if you have erectile dysfunction, you have a much higher incidence of high blood pressure, heart problems, high cholesterol, diabetes, and also including psychological problems. So all this must be treated and not just the erectile dysfunction. In fact, I will refuse to treat the erectile dysfunction unless, say, for example, the diabetes is controlled. I did a small study in my own hospital and I found very similar findings, except that up to 20% of my patients at that time also have a low T, they've got testosterone deficiency syndrome. And I published this in the International Journal of Urology in the year 2002. In the year 2000, we also did studies using sildenafil or Viagra with other agents, and we found that these medications are safe in the local community. But what is more important is that only 10% of men with erectile dysfunction have talked to the doctor about ED, and only 6% actually have treatment for their erectile dysfunction. Because patients are very worried about side effects, but actually the side effects are not only seen in the treatment group, but also in the placebo group. Things like headache, vasodilation, there's flushing, rhinitis, running nose, myalgia. Generally speaking, these are very mild and do not stop the patient from continuing with the medication. When I was in GHKL, I published in 1994 the treatment of the impotence clinic, which I started. And one of the very important treatment is the injection into the penis, intracavernosal injection. It was a very popular treatment. It's safe and effective. And even nowadays, the same treatment can be used. This is the liquid, mixed with the powder and injected with a small a needle into one side of the penis. I always say the penis is like a twin tower. There are two cylinders in the penis. They have a communication between the two, and you inject into it. And most patients, 95% of patients, will have a good erection. And this, of course, is reserved to those patients which do not respond well to oral medications. The testes, penis, prostate bladder, all very interrelated. And so it's not surprising that there are some medications like tadalafil 5 milligrams, which can be used not only for improving the erectile function, but can also be used to improve symptoms associated with the prostate gland. Of course, we need to rule out any prostatic neoplasm, example by doing a DRE or digital rectal examination and doing some blood tests like tumor markers like PSA, prostate-specific antigen. Next, I come to the important topic of T or testosterone. Of course, we know that T is important for sex, for libido, for sexual function, but it's also important for many other bodily functions like your muscle, your bone, your fat, your mental function, your sleep. So it's something like male menopause. So now the most effective treatment for male menopause is a testosterone gel, which is applied daily in the morning, and this keeps the testosterone at physiological range, different from injections. And finally, you can also have fertility so long as you produce some sperm in your testicles. So this can be aspirated from the testicle, can be injected into, can be kept in the sperm bank, can also be injected into an ovum called intracytosponsic sperm injection. So therefore, almost every man can have a good erection and can father a child. And so now we move to other factors like your diet. You should take more vegetable, more fruits, less calories, less alcohol. You should exercise. You should try to maintain an ideal body weight. You should reduce smoking. And finally, of course, you can also take some medications. Exercise is important because it stimulates hormonal release and utilization of testosterone. Of course, extremes of exercise, either no exercise or too much exercise, is also bad for your health. There's one particular exercise which is not good for penile health, and that is cycling for long hours because it causes pressure on the nerve and vessels to the